Good evening, good morning, and good afternoon to all of you, wherever you may be at this moment. My name is Cindy Bidding, President, ISSUP Malaysia, and I will be moderating this webinar on challenges in implementing effective prevention programs. With the upward trend in drug use globally, the need for effective prevention programs have become paramount. Evidence-based prevention can effectively reduce rates of drug use. So this webinar will bring us into this journey of implementing prevention strategies and the challenges encountered along the way. The speakers will be speaking about the challenges in the context of their own country. With us here are three amazing ladies, and let me introduce them to you. First, let us welcome Ms. Susan Mao from Kenya. She works with the National Agency for the Campaign Against Drug Abuse, or NACADA. Ms. Mao serves as manager at the Public Education and Advocacy Unit of NACADA, where she is in charge of DDR initiatives with a focus on prevention. Ms. Mao is responsible for overseeing the development and implementation of alcohol and drug use training and programming for schools, workplaces, family, media, and community. Her recent milestones include the development of national guidelines for alcohol and drug use prevention in 2021. Also, the national guidelines for prevention and management of alcohol and substance use in basic education institution 2021. And the Code of Practice for Prevention Professionals in Kenya in 2023, as well as the National Alcohol and Drug Use Prevention System in 2023. Ms. Mao has successfully initiated the first ever National Substance Use Prevention Week in Kenya in February this year. So that's about Ms. Susan Mao. And I would like to introduce the next speaker, Professor Sobia Aftab. Professor Sobia works at the Institute of Clinical Psychology, University of Karachi in Pakistan. She is also a practicing clinical psychologist and a UPC trainer with UNODC in Pakistan. She is an assistant book reviewer and editor in the university's journals. She also serves on the editorial and advisory board in a number of national and international journals. She is also a certified hypnotherapist. So that's about Professor Sobia. Next, I would like to introduce Dr. Maria Corazon Dumlao from the Philippines. Dr. Dumlao is a medical doctor by profession and has been in public health sector for 26 years. Dr. Dumlao is the Chief Health Program Officer of the Third Line Health Division under the Bureau of Learner Support Services with the Department of Education in the Philippines. And aside from her current position, she is also a global DDR trainer on UPC and an ICAP prevention professional. She has trained in several countries, including in Malaysia, UAE, Fiji, Thailand, Myanmar, and South Africa. So that's about our three speakers. I will now hand over to our first speaker, Ms. Susan Mao. Susan, over to you.
Thank you. Thank you for ISSUP Malaysia for having me here. And I will be sharing with you the situation in Kenya. If I can be allowed to share my screen. Thank you. All right, so I will take you straight to but you know, for us to talk about the challenges, we really need to see what else that we have done so that we can then talk about the challenges. So in this session, I'm going to share what we have done in Kenya. I will then talk about the challenges, and then in prevention, it's good to also say, okay, with these challenges, what are you doing? So one of the things that we have done in Kenya since way back in 2014, when we had the first group of people trained, we have actually disseminated the UPC, Universal Prevention Curriculum in Kenya. And you can see we have done Introduction to Prevention Science, the school-based prevention, the workplace, the faith-based, the media-based prevention, and also the UPC core. I would like to say that this is something that is ongoing. The advantage being the national focal point, it gives us an opportunity and the mandate to be able to build capacity in across the country. One of the things that is the guiding tool in prevention is the International Standards on Drug Use Prevention. And when you're on the ground and you're talking about international standards, it seems very foreign, and therefore it becomes, to bring it closer to the people, it becomes necessary to actually domesticate it. So what we have done is to domesticate the international standards on drug use prevention, and now we have the national guidelines on alcohol and drug use prevention. One of the things, if you just talk about drug use, then the interpretation is, oh, you are talking about drugs, like medical drugs, as it were. So that is why. And in Kenya, we tend to use the term alcohol and drug abuse. And so aligning it to the local situation, we have the national guidelines, and therefore this becomes our guiding tool to address this. I'm also going to share with you some of the things that we have done. And in prevention, you know that we need to work in settings. And so I'm just going to share about the 4 settings. What is it that we have done so far in the 4 settings? And so 1, you will find that for prevention to work best, it needs to be informed by research. So the first thing that we have done, as you can see, we did a secondary school national survey, followed by a primary school survey, because then it informs the status of things on the ground. And so from this research, we have been able to develop the national guidelines on prevention and management of alcohol and substance use in basic education institutions. It's not enough to do that. It's got to be disseminated. So this is an ongoing activity of disseminating the school guidelines. In Kenya, we have slightly above 40,000 schools. So you can see we still have a long way to go. Now, besides that, we also have the evidence-based Botville life skills training, which we have introduced in a number of schools. And to be able to implement this, you begin with the teachers, because teachers are the implementers. So we've trained teachers, and then the teachers are from, we had 2 teachers from one school, but you can see with time you end up with attrition. And so far, we are in 213 schools, reaching slightly above 12,000 learners. This is also an ongoing activity. Now, when it comes to the workplace, we have both formal and informal workplaces. And one of the areas that even from the training you can see we have trained over 4,000, it's because we have a program that has been running in the public sector institutions. So again, informed by research. And from this program, one of the 2 key things that public sector institutions need to do is to have research, develop a policy, and then employee assistance program. Those are just some of the things that needs to be there. Then we have the community, which is the community-wide setting. And this is where laws need to be implemented. So it means that we also need to have teams working in this place. But one of the things that was missing is a framework for engagement of the various civil society organizations, both state and non-state actors, but mainly non-state actors. So again, together with the non-state actors, developed the framework for community engagement. So we are at the point of disseminating capacity building so that they can establish work groups, so that they can lobby and advocate for implementation of county laws, which have already been done. But again, if no one is following through, then it doesn't get done. Now, family is where I should have started. But I started with the school because that is where research has been done. We do national surveys every 5 years, but the component of family has not come out very clear. But from the children's secondary and primary school surveys, it was very clear that parenting was part of the gaps. And therefore, as a country, we have initiated the positive parenting program. So it means we are reaching parents wherever they are, in the schools, with the faith-based organizations, the civil society organizations, the workplace, wherever parents can be found, we get there. And so we are talking of more than 12 million parents having been reached. So all these are ongoing programs. So having said that, the good and nice things that we are doing, what are the challenges? The first and the biggest challenge is the readiness for change, because we have been used to awareness creation. Now, when you go to evidence-based interventions or even prevention programming, then it means that there is need for a shift to come from just talking to 1 million people or 1,000 people to actually doing something which can be counted, which is informed by research. And the first that we find is the low perception of harm, especially when we talk about traditional substances. So actually, people actually don't know that there is harm that is there. So that is one big challenge. The other is denial and even resistance, where it doesn't happen in my community. It must be the other community. In any case, we've had cases where from alcohol poisoning, people have died in the community. So then there is the feeling that it happens in that locality, but not ours. We are just okay. That comes with limited enthusiasm for just allocating resources and being able to cooperate when it comes to implementation, because people want to see. They want to see the change today, not tomorrow. So then that is one big challenge with prevention, because it takes a while. And so that brings us to the next thing about resistance to shift from that awareness creation. So for example, when you say, so far we are doing 213 schools, the question is, you have 40,000 schools. When are you ever going to get to the 40,000 if so far you have only done 213? So there's that resistance to shift, and therefore the desire to just see so much. Then there is the lack of action to help to move these efforts forward. They say, yeah, that sounds like a good thing, but in terms of just follow through, it becomes a bigger challenge. The other thing is resources run out, and therefore scale up is an issue. Because if we have trained 2 teachers so that they can reach the students in their school, and they begin from grade 5, so that each year they reach out to grade 5, then you find that if you don't have resources, continuity then becomes a problem. The same even with monitoring, because monitoring is a key element when it comes to prevention, and especially implementation of evidence-based programs. Then prevention is also very subtle. You will not see change today, because you expect to see change in, let's say, if it is grade 5, you'd want to see by grade 8, 3 years down the line, how many have initiated substance use, how about the skills that they have developed, and so on. So you find that when it comes to allocation of resources, you who is talking of 3 years to come will have a much more difficult time explaining this. And so That is the big challenge. And lastly, I've just talked about the quantity versus quality. When are you going to reach the 40,000 schools compared to the 12,000 children that have been reached in these 213 schools and the ripple effect that they have on that? So that is also a very big challenge. So how do we address these challenges? The interventions being backed by research so that we can make a case for evidence-informed interventions. Because, for example, if it is positive parenting, you say, this is what came out from the survey. And so this is why we are doing this. So the interventions need to be backed by research. Then we have the development of a framework so that we can support the prevention work. It was one of the gaps that we had. And so being able to have this in place for the code of practice for prevention professionals, the guidelines for schools, the prevention system, and so on. It's very important to have them so that then dissemination can be ongoing to help to just present what needs to be done and in a systematic way, because that is what evidence-based interventions is about. And then capacity building, something that is ongoing so that we are able to raise a critical mass of people speaking the same language to be done in various settings. So these are some of the things that we have done. And lastly, leveraging on partners and then the use of locally available resources so that people, yes, it is expensive to do prevention, but how about sharing the resources that we have? Thank you so much.
Thank you so much, Susan, for the wonderful sharing. Wow, it is such a massive work that you do in Kenya. Very impressive. Your capacity building, you're reaching 10,000 school is no joke. And yeah, impressive. Yet, in spite of all the constraint of resistance, resources, and monitoring, all this, you soldier on. Very good. Yeah, and next, I would like to hand this over to Professor Sobia, please. Over to you.
Thank you so much. So I'll be talking about the challenges in implementing an effective prevention program in Pakistan, basically. So, so what we are going to learn during my presentation, we will understand the challenges that prevention specialists face in successfully implementing substance use prevention intervention programs in Pakistan. We will understand the strategies to address these challenges. So let's have a look on substance use problems worldwide. So the recently published World Drug Report 2023 by the United Nations Office on Drugs and Crime have published this data, and this data basically covers the statistics till 2021. So 296 million people worldwide have been found to use substance, and between the ages of 15 and 64. And out of these 296 million people, 11.2 million were basically injecting drugs, and around half of them were living with hepatitis C. 4 million people were living with HIV, and 1.2 million were living with both Hep C and HIV. So unfortunately, we don't have an updated statistics of Pakistan. So the last survey which has been conducted in Pakistan by UNODC, that was conducted in year 2030. So, and according to that survey, 6.7 million people are basically using substance, and out of these 6.72 million, 5.2 million were are men, and 1.5 million were women. And out of these 6.7 million, it has been seen that 4.2 million people have developed substance use disorder. So recently, in year 2022, UNODC has launched a national drug use survey 2022 to 2024 in Pakistan. So the result has not been published yet. So if you see the 2013, the trends of substance use in Pakistan, according to the 2013 survey, so the substance use is, and the unofficial reports, which has not been published anywhere. So if you look into those reports that indicate that substance use, the rate of substance use is alarmingly high in Pakistan. So there is a need to come up with the prevention programs. So now the question arises, why prevention interventions? So unfortunately in Pakistan, so the prevention, the field of prevention is still in its infancy. There is a mushroom growth of substance use treatment and rehabilitation centers in Pakistan, but the prevention, there is a dearth of prevention specialists in Pakistan. And if we see the global statistics, and according to the one of the published report by NIDA, it indicates prevention strategies are anticipated to yield significant cost saving through reduced utilization of social and health services, treatment requirements, and productivity losses. So even when there is a substantial evidence that there are certain beneficial impact of substance use prevention interventions, it can be very challenging to put substance use prevention interventions into practice in Pakistan. So why this is so? So this is what, so I have highlighted some of the challenges which we, the prevention specialists in Pakistan, basically face. So I come to know through conversation with my friends who are basically my colleagues and my friends who are into field of substance use prevention. So I'll be discussing these challenges one by one. So just to highlight them, the first challenge is not available indigenous prevention intervention programs in Pakistan. Second is evidence-based, international evidence-based prevention programs. There are certain barriers associated with those programs. I'll be discussing those. Stigma associated with substance use prevents substance use prevention interventions from being implemented. There is a role in ambiguity. Ambiguity between prevention specialist or treatment specialist, fragmented prevention programs, and lack of coordinated efforts. So these are some of the challenges. I'll be discussing each one by one. So the first challenge is we don't have indigenous prevention intervention programs. So if you look into UNODC standards for substance use prevention, they emphasize that prevention programs should be indigenously relevant. They should be culturally relevant. So the prevention programs must be sensitive to the cultural differences and equip the targeted populations with the skills and knowledge necessary to prevent and manage substance use in everyday circumstances. So integrating indigenous worldviews, values, languages, and beliefs into prevention programs basically improves the suitability, effectivity, but also increases the sustainability of the preventive interventions. But unfortunately, there is dearth of indigenous prevention intervention programs since, as I said, so there is a mushroom growth of substance use treatment and prevention interventions, but we don't have, the prevention field is still in its infancy, and we didn't do much work in the field of substance use prevention. So now what is the alternate? If we don't have indigenous intervention programs, we rely on internationally evidence-based programs. So now the problem with the, there are certain barriers which are basically associated with the international evidence prevention programs. There are hundreds of programs and interventions and policies that have been evaluated and ranked for their efficacy, and they have been found efficacious in reducing substance use and related problems worldwide. And there are a number of registries available. However, one of the barriers associated with these programs is, number one, is the lack of finances. The majority of the evidence-based prevention programs are highly paid. They are copyrighted programs, and they are too expensive for us to buy. So hence, the non-affordability poses a significant challenge challenge that even we have few prevention specialists, but they cannot make like big contribution in the field of substance use because of the lack of financial resources, because still we are the developing country. Second one, and the second, the barrier comes at the second challenge when we want to implement evidence-based intervention programs, even if it's not like very expensive and we are in a position to afford that and we can purchase that program. So the second barrier comes cultural relevance, because majority of the intervention programs, yes, they can be customized to meet the cultural requirements of the targeted groups. However, the implementing team needs to be prepared for it such that adaptations are fidelity consistent to the program. So adaptation with fidelity is one of the challenge, like how to do that. Adaptation of intervention is not only time-taking and hectic, but it also requires training, monitoring and supervision, and human and financial resources. So again, post-barrier financial resource basically pertains to this cultural, pertains to the basically adaptation of the interventions in Pakistani cultural context. Third barrier, human resource. There is lack of, as I said, the field of substance use prevention is still in its infancy. So there is lack of certified substance use prevention specialists in Pakistan. The prevention specialists who are already in the field may not be trained in evidence-based prevention or interventions. Here, I would like to appreciate the efforts of UNODC and ISSUP Pakistan chapter as well, that they have produced substance use prevention trainers in Pakistan, in all 5 provinces of Pakistan. Though they are few in numbers, but at least they have taken this initiative. And in last 2 to 3 years, they have produced substance use prevention trainers in different sectors. The third challenge, which is associated with the which is basically associated with prevention interventions, implementation of prevention interventions in Pakistan, is stigma. Because climate of acceptance for any prevention intervention program is essential. So the stigma is one of the major barrier that prevents us, the prevention specialists, to implement prevention interventions in Pakistan. The stigma associated with substance use, if we see from where the stigma arises. Basically, the stigma associated with substance use has its origin and the historical categorization of substance use as a moral failing and character flaw. So eventually, the mistrust, perceived stigma from service providers and community, self-stigma, that is self-devaluation, and dread stemming from association with the stigmatized group are typical factors basically that prevents the prevention specialist from implementing the substance use intervention programs. Another challenge I highlighted in the initial slides, role ambiguity, prevention specialist or treatment specialist. So in the field of addiction sciences, the prevention specialist credential is one of the rapidly growing area in Pakistan. And as I said, UNODC and ISSUP Pakistan have produced certain substance use prevention specialists in different regions of Pakistan. But the majority of those who stepped into the field of prevention sciences are also the treatment professionals or providers. So therefore, the field of prevention is moving very slowly due to the job ambiguity, which is brought on by wearing 2 hats. Namely, like you are confused between, are you a prevention specialist or are you a substance use treatment specialist? Which one should be your priority? Should it be substance use prevention field or should it be the treatment field? So wearing 2 hats have also, like I would say, have damaged the field of substance use prevention or negatively impacted the field of substance use prevention in Pakistan. The last challenge I have highlighted is basically the fragmented prevention interventions, that is the lack of coordinated efforts. There is a lack of coordination and integration of prevention programs, implementation initiatives across multiple sectors of non-governmental and governmental organizations. So there are different non-governmental organizations, there are governmental organizations like Ministry of Narcotics. Ministry of Narcotics Control has taken certain initiatives. Anti-narcotics force has taken certain initiatives for the community prevention. The Higher Education Commission Pakistan has launched a substance use policy in higher education institutions of Pakistan, which has been now introduced. So, but all these organizations are like basically working separately. So these are basically the efforts are very fragmented. So they have their own prevention programs. They don't have any coordination or collaboration with each other. So that is another like challenge in implementing substance use prevention interventions. So now how we can like what are the strategies now? What are the strategies which we can use to basically address or circumvent these challenges? The first, we need to reduce the stigma reduction through advocacy, promoting the provision of substance use prevention. So we need to emphasize that substance use is a public health problem. So we need to bring awareness among masses about this. In this regard, school, colleges, and universities can play a vital role in creating awareness and implementing and supporting the prevention specialists in implementing drug prevention initiatives in school settings, school, college, and university settings. Other than there should be a coordination between like inter-organization coordination among different organizations like Ministry of Education, Ministry of Finance, Ministry of Health, Ministry of Narcotics Control, school, colleges, universities, social work, faith-based organizations, and different other sectors. There should be a collaboration and coordination for substance use intervention programs. They can come on like one page and they can do the coordinated efforts. And other thing is the capacity building of workforce and prevention specialist and prevention team. As I said, we lack prevention, the prevention team or the prevention specialists who are trained in evidence-based substance use prevention interventions. So in this regard, I would like to highlight, as I said, higher education institution in Pakistan have launched have introduced, in fact, not launched, have introduced substance use policy in higher education institutions of Pakistan, and with the support of World Bank, they are offering different research projects. And one of their project, Local Challenge Fund, which they have announced 2 years ago, they have awarded 2 years ago. So substance use prevention was their priority in the theme of those projects. And my institution has this honor that we won this one of this research project. And me, along with Dr. Salman Shahzad and Dr. Uzma Ali. Dr. Salman Shahzad is the principal investigator and prevention investigator, along with Dr. Uzma Ali. And three are basically Pakistan, where we're doing universities. So recently, the national substance use policy has also been launched. So still, it's in the process. So this is all from my side. Thank you so much.
Thank you very much, Professor Sobia. Wow, yeah, like in so many other countries, prevention is still in its infancy, and along with the managed challenges, yeah, the challenges are enormous, bearing in mind also that prevention strategies need to be culturally sensitive, and also things like fragmented programs across the various agencies. I think we share similar challenges. Thank you so much. So let me call upon Dr. Dumlao, please. Dr. Dumlao, the stage is yours.
Hi, everyone. I would like to thank Mom Cindy and ISSUP Malaysia for this opportunity to present our challenges in the implementation of effective prevention program in the Philippines. And greetings to Susan and Professor Subia and to all our ISSUP colleagues who are here. My presentation consists of 3 parts. First is the background. Second are the challenges and strategies to address such challenges, and of course, the ways forward. For the background, we will be having a review of the basics. What is substance use prevention? What is evidence-based prevention interventions, and the barriers to evidence-based intervention and the UNODC standards. I'll just fix the, okay. Now, for substance use prevention, we have learned that prevention is the application of prevention science to address the health and safety of individuals through improving socialization and socialization processes to enhance self-realization and participation in the society. And the general aim of substance use prevention is for the healthy and safe development of children and youth to realize their potential and become contributing members of their community and society. And the primary objective of prevention is to help people, particularly young people, avoid or delay the initiation of the use of substances, or if they have started already, to avoid developing disorders or dependence. And we also learned about evidence-based practice, which is the use of systematic decision-making process or provision of services which have been shown through available scientific evidence to consistently improve measurable client outcomes. The basis for the decision making is not on tradition, gut reaction, or single observations, but relies on data collected through experimental research, and it accounts for individual client characteristics and clinician experience. Let's look at the general barriers to implementing EBIs. It often appears to go against conventional wisdom, and it challenges cultural and religious beliefs with regards to parenting, family structure, gender roles, and it requires new skills and specialized training, and the delivery challenge to maintain implementation fidelity. That's also a great challenge. The UNODC standards provide guidance in our planning and advocacy. And for the different settings, we have the family, school, community, workplace, and health sector across different developmental stages, from prenatal and infancy to adulthood. So most of the interventions are based on the evidence-based practices and interventions in the different settings. And for part two, we go now to the challenges and strategies in the Philippines, and these are related to three areas: institutionalization, implementation, and implementers. Now let's look at the challenges related to institutionalization. There's a need to integrate and align government efforts with the national plans and platforms for prevention, and institutionalize and sustain prevention programs and advocacy efforts. There are also challenges related to implementation as to enforcement of policies, guidelines, and standards, mobilizing resources for substance use prevention, research, monitoring, and evaluation, and of course, those that are related to the implementers, reframing mindsets, social cultural barriers, and addressing social stigma, and professionalizing the prevention workforce. Now, related to institutionalization, the key offices in government are members. This serves as a platform to discuss substance use prevention issues and strategies to address the problem. My presentation will highlight the school-based setting of the Department of Education. And we also have the Philippine Anti-Illegal Drug Strategy, or the PADS. And the enhanced PADS is geared towards a community-based treatment, rehabilitation, prevention, reintegration, and aftercare, and it ensures the whole-of-nation approach to address the country's drug problem with an emphasis on the holistic and evidence-based implementation. The third challenge is on the Department of Education Philippines Matatag or Resiliency Agenda of the Vice President and Secretary, particularly for the TAH, which is taking care of the learners' well-being and also creating a positive learning environment. Now, there's also another platform, the Operational Plan for Healthy Learning Institutions, wherein there's a joint administrative order signed by the secretaries of the Department of Education, Commission on Higher Education, Department of Interior and Local Government, the Technical and Vocational Skills, and legal colleges to ensure that all the 46,000 schools move towards being a healthy learning institution. And integration of substance use prevention efforts in these platforms ensure a holistic and strategic support at the national level. Let's look at another challenge, which is institutionalization and sustainability of programs and advocacy efforts. We have strengthened the National Drug Education Program issued through a policy, which is a comprehensive educational program which provides for a holistic approach to the problem of drug abuse and is designed to enable all sectors to work collaboratively with the school system as the core, thereby unifying all efforts at the sectoral level. We also have the integration of preventive drug education in the National Drug Education Program, having its 5 components: curriculum and instruction, co-curricular and ancillary services, staff development, parental education and community outreach, and monitoring and evaluation. As to the programs and advocacy efforts, the youth's involvement is made more meaningful with their participation in the Friends Against Drugs campaigns, conventions, and search for outstanding implementers. Third is the piloting of EBI packages in partnership with UNODC, Colombo Plan, USINL, and other NGOs, and membership in the Global Coalition to Address Synthetic Drug Use, and showcasing country testimonials on substance use prevention. Let's look at challenge number 3, enforcement of policies, guidelines, and standards. The Philippines has already issued several drug prevention education policies. We already have policies in place for the National Drug Education Program, Drug-Free Workplace Policy, random drug testing, and also preventive drug education. We also have the comprehensive tobacco control, which is a response to the global treaty, national laws, national issuances, and dependent issuances, and the schools as healthy settings through the joint administrative order on the healthy learning institution. However, even if we have these policies in place, the enforcement is still a challenge, especially in hard-to-reach schools. We have 46,000 schools, and though the policy is addressed to all of the schools, implementation still varies. Number 4 is mobilizing resources for substance use prevention. Aside from the funding secured from government priorities, we maintain a strong collaboration with international partners such as the Colombo Plan Drug Advisory Program, USINL, UNODC, UNICEF, among others. And we also have local partners through the DDB, ASEAN Training Center for Preventive Education, Department of Health, Health Justice, Social Watch, Philippine Pediatric Society, among others. The 5th challenge is on research, monitoring, and evaluation. The DDB survey and Global Youth Tobacco Survey and Global School Health Survey are examples on how research contributes to the wealth of information in aid of policy. For the sixth challenge, we have addressing social stigma and discrimination, where the DepEd's commitment is to come up with legislative advocacy. DepEd's comments on the proposed amendments to the existing drug law was anchored on UPC principles and the UNODC standards. UPC principles are highly considered in the formulation and implementation of policies and programs. For example, in the Philippines, we have a law mandating random drug testing, but we ensure that it's not a standalone activity. It is a package as part of a more comprehensive program. Compassion is a guiding principle in the draft policy in preventive drug education. In reframing mindsets, DepEd implements national and field rollouts of UPC trainings along with efforts to professionalize prevention among NDEP coordinators. Seventh challenge is on the professionalizing the prevention workforce. So we do continuous capacity building initiatives for our NDEP focals. Here are the trainings conducted led by the central office or the national office, wherein we were able to adapt with conduct the training with adaptation to fidelity, and we have a budget to ensure that our national trainers finish the managers and supervisors series, and that at the subnational level we also ensure that there is budget for them to do the rollout trainings. These are the rollout trainings for UPC2. And we also do various trainings on different aspects of prevention, trainings for school heads, trainings for guidance counselors, PTA officers for the systematic training for effective parenting, and trainings on tobacco control. And as to the efforts to have the credentialing examination, we have partnership with USINL and Colombo Plan for the series of TOTs for the school-based track, and we had the refresher course before they take up the examination. We were able to hurdle 13 passers for the ICAP P examination given last February 2024. For our ways forward, of course, we need to strengthen the implementation of our operational plan for healthy learning institutions, strengthen partnerships, conduct CAPI, continue with the credentialing exam for all the UPC trainers, and provision of screening and interventions for those found with substance use issues, proposed partnership with the UNODC for EBI packages, which I always believe that these are very expensive. And then, of course, creation of advisory group on tobacco control as part of the commitment of the Philippines for the smoke-free movement with Social Watch Philippines, integration of substance use prevention in adolescent reproductive health and school mental health efforts and advocacy, and of course, review and update policies related to substance use for the tobacco control to include ends and institutionalization of the after-school sports activities incorporating substance use prevention, and of course, documentation of best practices. So these are the challenges and the strategies that the Philippines conducted to address and institutionalize our prevention efforts. Thank you very much for this opportunity.
Oh, thank you very much, Dr. Dumlao. In spite of all the challenges, a lot of work has been done in prevention in the Philippines, and in particular, your drug prevention education in school is really the way forward, because schools are the best place to start prevention. And then, yeah, in spite of all these challenges, you soldier on. Congratulations. So we have come to the end of our presentation, but not exactly the end, because there are really so many questions. I'm going to have to look at some of the questions that I need to see who would answer this. Yeah. Okay, Susan, you have a question from people. Let me start with you first, Susan. It says here, the question here say, how do you, how easy, or I think, how easy is it to get the involvement of key stakeholders to enable you to reach these huge numbers, Susan, huge numbers of people that you have trained in UPC?
So thank you so much for that question. I work at the national focal point. So it means that we are actually mandated to do this throughout the country. And therefore, over time, we have actually developed strong relationships with our stakeholders. So that if it is Ministry of Education, then we are able to link up with them. Now, some of them are even members of, are represented as members of the board in our institution, like Ministry of Education. We have Ministry of Health, yeah, you know, the police, you know, anti-narcotics unit. So various organizations are represented there, but we also have a wider reach, and we continue to decentralize so that we can reach even to the lowest unit. So bringing together various stakeholders is actually our strength. Yeah.
All right, thank you very much. Then next I will have one question for Professor Sobia. Hang on, yeah, I'm trying to look now. I have, whoa, where did I? Hang on. I think there are just too many questions, but let me, yeah. One of the question is, Professor Sobia, it say, I'm curious if there's any support from local government on the local prevention work.
Yes, as I said, like recently, the government has launched a national drug use policy. So it has been launched, and there is also Ministry of Narcotics Control is basically actively working on it. And it's basically with the support of the Ministry of Narcotics Control that higher education institution has introduced the substance use policy in higher education institutions of Pakistan. So yes, we do have a support, but as I said, the prevention field is still in its infancy. It's still growing up. Yes.
I think there's one more question for you here. Actually, too many, but let me just choose this. This person is from Rwanda. He's a psychiatrist, and he said, I just wanted to learn which framework did you use to deduce those barriers and strategies. It is very comprehensive. You know, you were talking about the challenges, the barriers, and the strategies that you use to overcome those barriers. Which framework did you use? He wanted to know.
It's the strategic framework by UNODC, which basically we are following to overcome these barriers. So there are like certain external barriers, there are some internal barriers. So we are basically using that strategic framework.
Okay. Now I have something for Dr. Dumlau, but now I'm trying to get to it. I can't find it anymore. Sorry, hang on for a while. I can't see the question anymore. There were just too many actually. Okay, there was something just now for you. Oh yeah. This person say, Dr. Dumlau, this person asks you, what are your thoughts or experiences of harm reduction models as prevention strategies or relapse or overdose? What are the challenges specific to harm reduction model? Dr. Dumlao.
We have partnerships with several NGOs, and harm reduction is also a new field, and sometimes there is resistance when it comes to our country because they have associated needle syringe exchange program with that of the harm reduction. But we always say that harm reduction should also be viewed in the context of treatment, particularly the importance of compassionate pragmatism and showing compassion to those who are really into substance use is something that we have to be open to, considering that there's a journey that a person takes from the moment he or she started using drugs towards addiction. Harm reduction in the school setting can be advocated by simple messaging like if you have a friend and that person is your friend is under the influence of liquor, do not already ride with that person because then you will be in trouble. You will also suffer the consequence. I think what is interesting with harm reduction is how to contextualize the messages and adapt it to the specific age groups, because messaging for young kids on harm reduction is also a challenge. It is not so much challenging for adults who are into treatment, but to sell the idea and come up with messages for each specific age group, that's a challenge.
Right. Thank you very much, Dr. Dumlao. I think we have time, for one more question for you, Susan. Susan, are you there? There is somebody asking you. Hi, Susan. Someone is asking you, with the level of work that you have done in Kenya, could you talk a bit on sustaining the gains made?
All right. So thank you. When we talk about sustainability, like I said, if you embed it in existing systems, because that's if you start it as a standalone, then it looks expensive. You pull out it, the people you leave behind will be asking, who is going to continue with this work? So what we do is, as much as possible, embed it in existing systems. For example, the life skills training program, when we introduce the evidence-based life skills training program, on the school timetable, there was already a life skills, a life skills session, but it was not being used for life skills. So when you come and talk about making it better, utilizing this existing lesson, in as much as we recognize that the evidence-based LST will take more time, but having introduced it to make it better, you find acceptability is much more. So as much as possible, use the existing structures. Yeah, thank you.
All right. Thank you very much. Thank you very much, everyone, for your participation. Thank you very much, Professor Sobia, Dr. Dumlao, Ms. Mao, and ISSUP Global. Thank you, Kwado and Olha, for making this possible for us. Have a nice day, a nice evening. Thank you. Bye.
Thank you. Thank you.